Have you ever wondered about the disease that affects millions globally and yet remains shrouded in mystery? Today, we're peeling back the layers on tuberculosis, a disease that's been a part of human history for thousands of years. Over the next few minutes, we'll be diving into the causes, symptoms, and treatment of this enigmatic sickness that continues to baffle and challenge medical professionals across the globe. So, buckle up your mental seatbelts, folks. Get ready to uncover the enigma of tuberculosis. Tuberculosis, often abbreviated as TB, is an infectious disease that primarily affects the lungs. This disease, which has been with humanity for thousands of years, is caused by a bacterium known as Mycobacterium tuberculosis. So how does this bacterium cause such a widespread disease? Well, it's all about the way it travels. When a person with TB in their lungs or throat coughs, sneezes, or even talks, they send the bacteria into the air. Anyone who breathes in these bacteria can become infected. It's a bit like catching a cold, but with much more severe consequences. But don't be mistaken, TB isn't picky. While it primarily targets the lungs, it can also spread and cause disease in other parts of the body, such as the kidney, spine, and even the brain. It's important to note that not everyone infected with TB bacteria becomes sick. In fact, you could carry the bacteria in your body without feeling ill or spreading it to others. This is what we call latent TB. However, if these bacteria become active and multiply, that's when TB disease occurs, and it can be fatal if not treated properly. So, to recap, tuberculosis is a bacterial infection, primarily affecting the lungs, but it can also infiltrate other areas of the body. It spreads through the air, much like a cold, but with far more serious implications. Understanding tuberculosis is the first step in combating it. So, how would you know if tuberculosis has invaded your body? Let's delve into the symptoms. First off, you might notice a persistent cough that lasts for 3 weeks or more. This isn't your average run-of-the-mill cough. It's one that lingers, sometimes producing blood or sputum. Next, you might experience chest pain or pain during breathing and coughing. It's like a persistent ache that won't go away. Also, watch out for fatigue. We're not talking about the kind of tired you feel after a long day, but a relentless exhaustion that doesn't improve with rest. Other symptoms may include loss of appetite, weight loss, chills, fever, and night sweats. These signs are your body's way of crying out for help. It's crucial to remember that early detection is key in preventing the spread and worsening of tuberculosis. If you or someone you know is experiencing these symptoms, seek medical attention promptly. Knowing these symptoms could potentially save a life. Now that we know what we're up against, how do we fight tuberculosis? Well, the primary weapon in our arsenal against tuberculosis, or TB, is a long-term course of antibiotics. These aren't your run-of-the-mill, take-for-a-week kind of antibiotics. No, we're talking about a heavy-duty regimen that can last anywhere from 6 to 9 months. That might seem overwhelming, but it's absolutely essential to ensure that all the TB bacteria are wiped out. The most commonly used antibiotics for TB include isoniazid, rifampin, ethambutol, and pyrazinamide. These medications are usually taken together as a combination therapy to prevent the bacteria from developing resistance. It's a bit like going in with all guns blazing to ensure the bacteria don't stand a chance. Now, here's the thing. It's crucial, and I mean life or death crucial, that the full course of treatment is completed. Even if you start feeling better, even if the symptoms have disappeared, you need to stick with it. Why, you might wonder? Well, stopping early can lead to drug-resistant TB, a far more dangerous and difficult-to-treat version of the disease. In addition to medication, supportive care such as a balanced diet and plenty of rest also play a part in the recovery process. It's all about giving your body the best chance to fight off the disease. With the right treatment, tuberculosis can be beaten. So let's not give this pesky bacterium any quarter. Let's ensure we finish our fight with tuberculosis on our terms. So we've journeyed through the world of tuberculosis. We've learned that it's an infectious disease caused by the bacterium Mycobacterium tuberculosis. We've uncovered the symptoms, which can include a persistent cough, weight loss, and night sweats. We've also discussed the treatment options that hinge on a rigorous 6-month course of antibiotics. It's crucial to remember that early detection and treatment are key to defeating this disease. With knowledge comes power. Together, we can defeat tuberculosis.